this is one of our favorite ways to do this, from a park bench, the couch, wherever you can find a chair that you can sit in. And tell me a little bit about this one in terms of setting up correctly. Right now, I don't have a back to the chair,
Correct.
but talk to me through this one a little bit.
Yeah, so I think some of the same things apply that we've already talked to you about. Is that crank arm is trying to be at best position at where your shoulder is. This might be a little bit harder for people to get to that 5 to 10 degrees of extension at the furthest point away, but you can kind of let the Excy go a little bit here as opposed to being able to pull it close into you to make that adjustment so that it's comfortable. We can still be thinking about palms facing as a position. Now, without having a back, you're going to have to work a lot harder core-wise to stabilize your trunk. And that might be what you're looking for, and that might be the best thing for how you're trying to exercise.
Yeah. I mean, there are some things here, range of motion, and then there are things that you can do here athletically, right? Get your legs up while you're doing it, really engage your core, and crank the resistance up pretty high, but nice and straight.
Most people should start with the easiest position first, and then as they're stronger and as they can progress, then they can make things harder, add things in. But we want to make sure that people can do the basic level of the exercise before they're advancing. Otherwise, we tend to get into issues where people are compensating with muscles that they shouldn't be, or they're compensating in motions like extending their back too far, and that can create other injuries that now we're seeing someone for something else.
Yes, exactly. Okay. One benefit that we've seen with taking the non-injured shoulder with the injured shoulder and holding and walk me through your thoughts on the one hand.
Yeah. So as we spoke earlier, if one arm, say the injured arm or the involved arm, can't do the motion on its own, then we have the other arm on the pedal to be able to assist that motion. Once it's gotten stronger, now we may want to isolate that arm to make sure that it's doing the work and the other side hasn't taken over. The other benefit to hanging on with this uninvolved arm is that that side is now stabilizing as well. So it's getting some isometric contractions and some stabilization in that shoulder. So I might even see some benefit for some patients to hold and stabilize with their injured or involved side and using the other side to do the work, because now you're having to do a lot of stabilization with that side.
Awesome.